To prepare an injection from a vial, first verify the healthcare provider's orders. If you're using an automated medication dispensing system, log on and access the patient's profile. When preparing medications, it is important to avoid becoming distracted. Follow your agency's no interruption zone policy and always prepare medications for only one patient at a time. Select a vial of the prescribed drug from the dispensing system. Compare the name of the drug on the label of the vial with the name in the Medication Administration Record, or MAR. Check the expiration date and drug concentration or dose on the vial. Calculate the correct volume to withdraw. Double-check your work and, if necessary, ask another registered nurse to check your calculation. Check agency policy to note which high-alert medications require validation by a second RN. If the vial has not been opened, remove the cap to expose the rubber seal. Firmly wipe the surface of the rubber seal with an alcohol swab and let it dry. Select a syringe and attach a needle or needleless access device. If the syringe is capped, remove the cap first. A filter needle may be needed to withdraw certain medications from the vial. Review your agency's policy or the drug insert to determine if it's necessary to use a filter needle. This nurse is using a blunt tip needle to reduce the risk of needle stick injury. Then pull back the plunger and draw a quantity of air into the syringe equal to the volume of medication you intend to withdraw from the vial. Holding the vial on a flat surface, insert the tip of the needle or needleless device through the center of the rubber seal. Inject the air you drew into the syringe into the airspace of the vial. Press firmly on the plunger to overcome the air pressure within. Hold the vial with your non-dominant hand. Hold the syringe and plunger with your dominant hand. Invert the vial, securing the plunger to continue counteracting pressure within the vial. Keeping the tip of the needle or needleless device below the level of the fluid, let the air pressure in the vial slowly force medication into the syringe. You may pull back slightly on the plunger to hasten the process. When the level of medication in the syringe reaches the desired volume, position the tip of the needle or needleless device within the airspace of the vial. Tap the barrel of the syringe to dislodge any air bubbles. If air remains at the top of the syringe, eject it into the vial. Recheck the volume in the syringe. Finally, remove the needle or needleless device. Hold the syringe vertically, needle up at eye level. Make sure you have the correct volume and no air bubbles. Remove any remaining air by tapping the barrel to dislodge the bubbles. If air remains, draw back slightly on the plunger and push up to eject the air, taking care not to eject any fluid. Recheck the volume of the drug in the syringe. If you're using a needleless device or filter needle, replace it with a safety needle of the appropriate gauge and length before administering the medication to the patient. If you're preparing the medication away from the patient's bedside, clearly label the syringe with the name of the medication and the dose in the syringe. When you open a new multi-dose vial, write the date and your initials on the label, and then swab the rubber seal. If a multi-dose vial is already open, wipe the surface of the rubber seal with an alcohol swab and let it dry. Discard single-dose vials after use, even if there is medication remaining in the vial. If the vial contains a powder that must be reconstituted, remove the caps on the vials of medication and diluent. Be sure to check the manufacturer's guidelines for the correct diluent and volume of diluent to use, and if use of a filter needle is recommended. Wipe both rubber seals with alcohol. When the alcohol is dry, use a needle or needleless device to draw the diluent into the syringe as you would medication from a vial. To mix the diluent with the powdered medication, insert the needleless device or needle through the center of the rubber seal on the vial of medication. Inject the measured diluent into the vial containing the powder. Withdraw and dispose of the syringe or access device in a puncture-proof container. Mix the powder and diluent thoroughly by rolling the vial between your palms. Don't shake the vial. After you reconstitute the medication, read the label carefully to determine the concentration of the drug. Draw up the appropriate volume of medication based on its concentration in the reconstituted formulation. Some medications are now available in vials that contain both the medication and diluent separated by a gasket. To combine, press down on the plastic activator to force the diluent into the lower compartment. Remove the top and gently agitate the vial to mix the solution. Swab the gasket with alcohol and then insert the needle through the center of the stopper. Invert the vial and withdraw the dose. Again, compare the electronic MAR or computer printout with the label of the prepared drug. Remember, if you're preparing the medication away from the patient's bedside, label the syringe with the name of the medication and the amount or dose in the syringe. Dispose of used supplies and place the vial and used needle or needleless device in a puncture-proof, leak-proof container. Clean your work area and perform hand hygiene.